once you start Botox, you can never stop.
That is not true. You can do Botox once, you can do it 100 times. However, I could stop tomorrow and I'll enter my present age with fewer wrinkles in my face, so I will always look better than my age cohort because I've been doing it for 26 years.
Welcome to Beyond Beauty, where confidence meets care. Join us as we uncover the art, science, and soul behind today's most refined cosmetic treatments.
Hi, everyone, and welcome. We're here at Vancouver Laser and Skincare Center, Vancouver's largest aesthetic clinic. I'm joined today by Dr. Martin Braun, Medical Director and founder of Vancouver Laser. With over 30 years of experience in cosmetic medicine, Dr. Braun is internationally recognized as an educator and speaker in the field. He's known for delivering natural, beautiful results using the most advanced and safest techniques. And today, he's here to talk all things Botox. Good morning, Dr. Braun.
Good morning.
Why is summer actually a great time to start or continue Botox treatments?
Well, the nice thing about Botox, which is the #1 cosmetic treatment in the world, is that it's safe year-round, even in the summer. It doesn't matter if you have sun exposure, it doesn't matter if you're tanned. I also find in the summer, people squint a lot more. And when you squint, you use these muscles and these ones, and your crow's feet, these lines are going to get deeper. They're accentuated when you're doing this.
Some patients think you should avoid injectables in the heat or the sun. Is that true?
No, that's a myth.
Right.
You'll see that out there. I've done the most Botox in Canada for over 10 years running, and I've never seen a problem doing Botox and then running into a sauna or even going down to Mexico. It works perfectly fine.
Is Botox safe before going on vacation or traveling somewhere warm?
Perfectly safe. And it's nice to have that nice refreshed look, especially if it's your first time. If you go on vacation and then come back, all your co-workers and family simply think you are all relaxed and look better because you had a vacation, not just because you also did Botox 2 weeks earlier.
Another thing about the summer, Dr. Braun, is weddings. Let's talk about Botox before weddings. How far in advance should people plan? And is it safe to do that before the big day?
I have found with weddings, the best is to do your Botox 6 weeks before the big event. And I've actually learned this from brides. I have them take their picture after their Botox at 2 weeks, 4 weeks, 6 weeks, 8 weeks, and invariably they tell me the 6-week photo is the best, the skin is redraped, and they look the most natural.
Correct.
The other nice thing about having it 6 weeks before is there's plenty of time for a touch-up so that it's perfect for the wedding day. I've also found that Botox is very nice for hyperhidrosis, that's excessive sweating. Often you are shaking people's hands with your right hand, so one can put Botox in the right palm, and that will prevent any sweating or clamminess of your hand. So people really like that who are prone to sweating when they get nervous.
And this, of course, applies to the groom as well, I assume.
Yes. And anyone else in the wedding party.
That's true. Okay. What's the benefit versus other treatments that cause peeling or redness?
Well, we have many treatments, a lot of the energy-based treatments, which can result in some peeling and redness. So those would have to be done a good 6 to 8 weeks before the big event. The advantage of Botox is that there is really no downtime unless you got a bruise from the needle.
Right. Most people think of the forehead or crow's feet, but what are some more surprising areas you treat with Botox?
Well, the lower face specifically. Everyone thinks of Botox for the frown and the eyes, and it works fantastic in those locations. However, I've also used Botox for many years for upper lip lines, lower lip lines, which I call the barcode. It's very aging, as well as the corner of the mouth, because we have 2 frowns, this frown and this frown, as well as along the jawline. That's known as the Nefertiti lift, named after Queen Nefertiti, the statue in the Berlin Museum. And you get a very nice tight jawline, also referred to as a snatch jaw, which you see on many celebrities when you put Botox along the jawline. Another area is the chin.
Yes.
In order to prevent witch's chin as you age, you require Botox. It took me about 10 years to figure that out, but every woman alive literally looks better with a more complete heart-shaped face when there's Botox in the chin.
I've heard about Botox in the shoulders and legs. What does that do?
Botox in the shoulders results in a longer neck because it reduces this angle of the trapezius muscle. This muscle, as it gets larger in this area, will often shorten a woman's neck, and when you lengthen it, of course, it looks much more feminine and attractive. The Koreans actually invented that idea. We also do it for shoulder and neck pain, but you will result in a nice aesthetic improvement. In the calves, it will also slim the calves, so you'll have a much more narrow leg that doesn't look, as the Koreans say, a piano leg.
Does it actually change how you look in dresses or swimwear?
Well, when you have a longer neck, it looks much more elegant in a dress, as well as the calves not being wide like a piano leg. So yes, you do look slimmer when you have the Botox done.
What about TMJ or jaw clenching?
We haven't touched on the masseter muscle, which is the primary muscle you use for chewing. All of us have some degree of bruxism, which is clenching or grinding at night, and it ranges anywhere from 1 to 100. Nobody has 0. And when you clench and grind excessively, this muscle gets stronger. It also gets stronger if you chew a lot of gum or eat a lot of hard foods. So as this muscle gets bigger, the lower face widens. It is not very attractive when you have big bulging right here in the lower face. You lose the triangle of youth.
Yes.
This should be wider, this area, than this. So we put Botox in this area in order to shrink the masseter muscle, which results in a more attractive heart-shaped face, but it also reduces the degree of clenching and grinding, which ruins your teeth, as well as puts a lot of stress on the temporomandibular joint. Having TMJ syndrome is actually not one of life's great pleasures, and there's very few treatments for it, and so why not prevent this from happening? In addition, TMJ can lead to a lot of headaches, and so by Botoxing this area, one can reduce that as well.
Some patients ask, do I need multiple sessions?
The answer is both yes and no. One can simply have one Botox session. However, for the best results, we advise doing it repeatedly. Botox is like exercise. The sooner you start, the longer you do it, the smoother the complexion. And if one would like to keep things like the masseter small, for things like bruxism and a wider lower face, yes, you'll require repeated sessions because you're going to go back to your clenching and grinding, which will strengthen the muscle. Same as for princess shoulder or the calves and many other areas in the body. So yes, we advise coming in 2 or 3 times a year for your Botox session. It's 15 minutes. We use the world's tiniest needle. It really is not painful, and so it's a beautiful treatment.
Dr. Braun, Botox weakens muscles. Why would I want to do this?
Many people have this concern. Yes, Botox does weaken your muscles. However, the muscles that we primarily use Botox on are all muscles that pull your face down. When you frown, you're pulling your face down. Okay? When you do this, you're pulling your face down. The platysma muscle pulls your face down. All of these muscles are pulling your face down, except for your upper forehead.
Right.
That's why we don't like putting Botox in the upper forehead. When I apply Botox to all these areas here, I'm reducing your ability to pull your face down and help gravity. Gravity is already doing a great job. I've never seen a woman tell me that she can defy the effects of gravity, or a man for that matter. So why help gravity pull everything down? So Botox is helping you in that regard, that your face is not being pulled down on a regular basis.
Can you speak to drooping of the face?
Yeah, some people bring up the fact that they feel that Botox caused some drooping of the face. The only time this would occur is with excessive use in the masseter muscle. If they rely on this muscle to pull out and lift their face, because they've had a large masseter for decades, then one has to be very careful with reducing the masseter volume. If it is necessary to reduce the volume of the masseter because they have issues like temporomandibular joint dysfunction, TMJ syndrome, or severe bruxism, they're cracking their teeth, grinding off their molars, we can reduce this and then put some fillers behind the masseter in order to make up for the lost volume. Because if you lose too much volume here, you can get jowly here, but that can easily be corrected with fillers along the jawline or behind the masseter.
Okay, some true and false questions, Dr. Braun. Once you start Botox, you can never stop.
That is not true. You can do Botox once, you can do it 100 times. I've had Botox in my face for over 26 years. I will not stop because I like the effects. However, I could stop tomorrow and I'll enter my present age with fewer wrinkles in my face, so I will always look better than my age cohort because I've been doing it for 26 years.
Right.
Remember, I also compared Botox to exercise. The longer you do it, the sooner you start, the better it is for your health.
Botox is only for older people.
That is not true either. Botox can be done at any age. However, when you start younger, before these lines have become etched in your face, you'll get much better results. In fact, you'll achieve perfection with no lines on the face when you start younger and keep it up.
You'll look frozen.
Yes, you can look frozen with Botox if you overdo it. But I mean, do I look frozen? I can frown, I can squint, I can lift my brows, and I have Botox on board. In fact, an entire bottle.
Thank you. If I stop, my wrinkles will come back worse.
That's another popular misconception. People feel if they're on Botox for a while and then they stop, the wrinkles will come back worse. The subjective experience of that person is that the wrinkles are worse is because they were so good and now they start seeing wrinkles.
Right.
But the wrinkles do not come back worse. Any person who stops Botox after doing it for a period of time is still better off than had they never done Botox. Again, compare it to exercise. If you stop your exercise, yes, your muscles will become weaker and you'll probably gain body fat. However, you're still better off because you exercised for a period of 10 years, 20 years, 30 years. You're not going to be worse off because you stop the exercise.
Thank you. Botox is painful.
Botox is not painful. We administer it with the world's tiniest needle. It's very quick. The appointment is 15 minutes or less, and there's no downtime. You go straight back to your regular activities. You'll see that many people advise, don't do this, don't do that. I've even read in Vogue magazine, you can't bend forward and go shoe shopping. It's utterly ridiculous. I don't know where these myths come from. I don't advise my patients to stop any of their activities. You can do whatever you like and there is no problem.
Botox is toxic and unsafe.
That's another great misconception. Botox is toxic and unsafe, people will say. This is not the case. We have over 40 years of experience. Literally millions and millions of people have had Botox. There has never been any recorded problem with Botox administered by itself in an adult. That has never happened.
Men don't get Botox.
Men are now one of the fastest growing cohort with Botox. In the past, over 90% of our patients have been females, but more and more men are availing themselves to this because they understand the benefits of the Botox, if anything, just in this area, so they don't walk around appearing angry. The other thing I'd like to say about Botox is that there are many people who love to hate Botox. I think that's because it's the #1 cosmetic procedure. There are researchers all over the world who have attempted for years and years to prove that it is dangerous. I actually like that these very smart people are doing this work because I've read it, and so far they haven't produced a single thing that frightens me, and that's why I put it in my face. I also put it in the face of my family. It has been very useful.
Dr. Braun, can you share any of your stories of a client who was surprised by the results of Botox?
Yes, well, one thing that is very poignant about Botox is that there's been a lot of work done that it also reduces anxiety and depression. I had one patient come in, a female, who asked me for Botox, and I started with the upper face, the frown right here. And then she came back a couple weeks later for a follow-up visit and told me more about her medical history, which she didn't share on the first visit. And that was that she's been depressed for over 20 years and seen various psychiatrists and had been placed on numerous antidepressants. And she told me that after the Botox, it was the first time in her life that she experienced a glimmer of happiness. And I thought, well, wow, I didn't think it would work that well. And I asked her to explain, and she told me she drove a bus for the city of Vancouver. And she feels now, when the bus door opens, that she had a very frustrated, angry, depressed face. Now she can no longer frown, so she doesn't look angry and frustrated. So when people see her, they see a woman who is no longer appearing frustrated and angry. They smile. They say, hello, how are you doing? You have to respond with a smile, now don't you, when someone smiles at you? As Oprah says, or Maya D'Angelo, you get what you receive. It comes back to you. And so by her now smiling for the first time in her life, it seems, she gets a smile back. The whole day goes better right now. You still have to work your 8-hour shift working. So isn't it much better to be smiling and chatting pleasantly with people? The day goes by faster. So of course she wanted to know, where else can I put Botox, because she found it so effective in alleviating her mood disorder.
What's the most rewarding part of seeing someone's transformation for you?
The most rewarding part is how happy people are. This is the one treatment, as I said before, that is a true home run in aesthetics. Assuming the Botox is done correctly, why wouldn't you like it?
Yes.
You generally look 10 to 15 years younger. You look much more pleasant. You look much more approachable. You no longer look frustrated and angry. You are no longer augmenting the effects of gravity pulling down our face. And gravity is working on all of us 24/7.
Yes.
Pulling down our faces. So why help that process? And so by reducing these dynamic lines that we produce with muscular contraction, which inevitably become static lines or a scar in the face,
Right.
don't you want to prevent that? That's why I equate Botox in the face to like exercise for your body. The sooner you start, the longer you do it, the nicer it is.
Yes. Yes, it's great. Dr. Braun, what are the biggest red flags when it comes to cheap or poorly done Botox?
Botox is like anything done in aesthetics. When it's poorly done, it looks unnatural, and then it becomes obvious. And these are the pictures that we see on social media, whether it's Botox, fillers, energy-based devices, virtually anything. When Botox is done well, it looks very natural and it's literally undetectable. When it's not done well, of course, you can see it. And then people think this is the norm. That's not the case. It was simply poorly done. Botox works very well, very consistently. And if there is a problem, it's generally the injector has put it in the wrong place or put too much in the wrong place, and then we have a problem. However, the beauty of Botox is that these problems are self-limiting and ultimately will wear off and go away. No one is permanently disfigured from Botox.
Thank you for joining us today, Dr. Braun. If you're thinking about Botox or even just curious about our Botox service option, this summer might be the perfect time to explore what's right for you. Big thanks to Dr. Braun for all the insights. For more information, please see the link below.
Thank you.
Thank you.